This is the session regarding the 2025 insights from Ohio Department of DD, waivers, accreditation, and system innovations. So representing the department, we have Allan Showalter and Nyoka Craddolph from MDA. We also have Lisa Burt from Compliance and Stacy Collins from the Innovation and Strategic Division. I always forget that. That's the one I had to look at. I was like, that's a big mouthful. All right. Well, thank you so much, all of you, to come. And we will have lots of information to go over and save questions for the end. So thank you so much. I'm going to turn it over to you guys. I think we're good. Nyoka, I was going to say these all are working, I think. You might have to flip it on. And we don't have a clicker, so you just need to arrow ahead. I know. I'm sorry. Do you want me to arrow for you? It might not be turned on yet. Just click it up and you're like me. There you go.
Okay.
Yep.
Okay.
Yep.
Okay. Hello, everybody. So I'm going to start with our January 25 waiver amendments. And I'm guessing most of you are pretty familiar with this information. So we're just going to go over some of this briefly. So effective January 2025, following CMS approval, the following changes, we're going to have the following changes. So we will have a new monthly subscription service called Healthcare Assessment. Currently, we will only have one provider of this service, but it will be open for other providers. And this is actually going to be a real-time virtual health assessment service. And some people have already been receiving this service through our pilot. So many of you are already familiar with this, but this is being transitioned over to a waiver service, hopefully following approval. So there will be some changes to this service, just basically to get it into, a traditional waiver service. But otherwise it will continue hopefully fairly seamlessly for people. So we're hoping that will all be ready to go in January. I don't want to kick this. So that will be effective. We also have created a special rate for a provider of non-medical transportation that is transporting a person to competitive integrated employment. And so these rates are per trip. They're based on 3 different mileage bands. And then also there's a modified and a non-modified rate based on the type of vehicle and the person's needs. The provider must transport only one person at a time. So that also will be effective in January, assuming approval. We did also update the definition of commercial transportation in this rule. So people will want to pay close attention to that. And then also there is a process for environmental modification for a person who has a need that exceeds $10,000 per project, which is currently what our rule stops at, is the 10,000. So if the person needs something to ensure their health and welfare that exceeds that, we were asked by CMS to create a process that allows that, very similar to what we just did with specialized medical equipment. So that was added to the waiver amendment as well. So again, following approval, that will be available as well. So we will be issuing a memo with that specific process that will detail how you submit that to the department. And we're taking all questions at the end. So if you have questions about these waiver changes, we have done all of our resources as we typically do. And most of you probably have attended trainings, and these resources are available on our website. Thank you.
Thanks, Nyoka. So in addition to the changes for January, we've also been doing a lot of work kind of thinking long-term about what sort of changes we want to make for our waivers. I'm going to talk about what we've been doing for the waiver modernization project for that. If you remember this, we started this project in early 2023 with 4 main goals. We wanted to improve the assessment process, likely replace the DDP, We want to review our shared living and remote support services to improve those services and to increase the utilization of remote supports. We wanted to ensure sustainable state and county funding of waivers, and we wanted to simplify billing for providers. This work is certainly ongoing, but I want to kind of give you a snapshot of the progress we've made and where we're at on this now. So on the assessment side, we spent a lot of time hearing from family members, from county boards about the DDP and the AI. And we spent a lot of time looking at what other assessment options are available. And we are continuing to work now towards implementing the supports intensity scale to replace both the DDP and the AI. This is, a tool that's used in numerous other states. It's been normed for people with intellectual and developmental disabilities. And everything we've heard is that it does a really good job of accurately predicting the level of support that people will need. The concerns that we really heard from families and from SSAs about the DDP were, first that, it conditions funding levels on, who is providing the service or where someone is living, and also concerns just about the consistency of the assessment. With the SIS, I think it provides a high level of training and oversight for the assessors. So I think we will, really improve the consistency of the acuity assessments. I think we'll have a better, more accurate picture of the level of support someone needs from the SIS. What other? It will also allow us to hopefully move into more acuity-based rates. So we'll be able to pay providers for services like HPC, based on the level of support a person needs. And it will hopefully also help us streamline assessments. To start, we will combine the DDP and the AI into this one assessment, and also be able to take away assessments for add-ons, because those will hopefully be included in acuity-based rates. They're also taking up time for SSAs. There's a possibility that in the future it could be used for a level of care tool, but we certainly are not considering that as an option in implementation as well. County funding was another, high-level priority of the modernization project. And I believe at this conference last year, Janet Steffen was here to talk with you all about our stop-loss proposal. And we are planning to implement stop-loss funding the next fiscal year. So stop-loss is an arrangement where the state will cover high-level waiver costs for qualifying counties if they meet, certain qualifiers. So a county that qualifies for stop-loss will know that it will only have to pay up to a certain amount for a waiver. The goal there is to protect counties from high level or high waiver costs. They're kind of outlier costs that they may not have planned for or may not have the budget for. And to ensure that the risk of a high level waiver is not a barrier to placing people on waivers across the state. So the way this will work is DODD is going to request some money in the state budget and also reallocate some money that we already have to fund this. And there will be qualifiers for counties. So counties will have to pay as much this year as they did last year for waivers to qualify. They will have to not have a certain amount of cash on hand and pay a certain amount of their local match to qualify. And if they qualify, then there will be a threshold amount, which is your average waiver spend multiplied by another amount. And that will tell the county, you will only have to pay for up to the threshold amount for waivers this year. And anything that goes above that, the state would then cover the costs for. We're hoping this, provides some protection protection for counties and some improved budgeting abilities for them as well. The other thing that we heard, particularly when talking to families and SSAs about the selected services that we reviewed in this project, the shared living or remote supports, was some need for additional SSA resources with the ever-changing DODD landscape and a lot of the turnover we've had in SSAs as well. So we've been working to develop an SSA resource guide to provide information on the Medicaid services available to persons served. DOD has been putting together that information. We met with 5 or 6 SSA directors recently to kind of talk through how to make sure we're making this resource guide most useful to counties. And we hope that this will be a place, kind of a living document where you will be able to find DODD guidance and information about DODD rules for all the Medicaid waiver services. A place other than the administrative code to get this information perhaps in a clearer, more succinct place. I think that is all I wanted to talk about for modernization, so I'll turn it over to Stacy Collins.
Okay. Realized I didn't want to trip over that bag. That would have been really, really nice. A good start to my part of the presentation, which would be typically what I would do. So good afternoon, everyone. Just again, I'm Stacy Collins. I work as Assistant Deputy Director in our Division of Policy and Strategic Direction at DODD, and our division works on several key initiatives across the agency in collaboration with multiple different divisions at the department, and many of you in the room around some key initiatives and some of the initiatives I've been asked to come some updates about today. So that's my plan. I'm really happy to be here with you, to see all of you. And for those I haven't met, hello. So I'm going to start off first giving some updates. So the OhioISP work sits with and in partnership with multiple divisions as well within our team. And so I wanted to provide some updates about what's going on with OhioISP. So for anybody new in the room, OhioISP is our initiative. We've been working in collaboration with you and others across the state many years in implementing one standardized assessment and plan for people who are on home and community members. I thought I just lost my mic for a second. And individuals who live in intermediate care facilities. And so this OhioISP is taking our system from what was over 400 different ways to assess and plan to one. And I know many of you have been working on it several years, and there's been nothing easy about moving to this one standardized plan, but the why was to really make sure that people with disabilities and their families, no matter where they were in the state of Ohio, they knew what the assessment looked like, they knew what the plan looked like, and it could go with them across the state. It's the same for providers and county boards. So we are working on the implementation of OhioISP, and it really has continued to progress over the last several years. Wanted to provide some just data and updates for you so you know where we are as a state. So one of the requirements of OhioISP is the template, right? That we use the same assessment and we use the same plan. But also a part of that OhioISP initiative is that then that material, that information actually gets communicated and sent to DODD in our system. And so no matter where somebody goes, that information can get pulled to the ICF, it can get pulled to the county board, it can get pulled for the individual or the provider. So my data is as of November 4th. So we have had 30 days since of data collection, but as of November 1st, our number, I can get my words out, I promise. November 4th, we nearly had about 57% of people who are on waivers who have fully transmitted, this is transmitted plans to DODD, 56% of people living in ICFs, and 73% of the individuals who are living in our developmental centers have an OhioISP that currently sits within the DODD online system. And so that is right now around 27,700 plans that have been transmitted to the department. So thank you for all of you for the work that you're doing in really going through questions of OhioISP, talking about who you are and what you need, but also working through that assessment and plan to make sure that we truly understand each person and what they need and getting a plan to meet those needs. A couple things I did want to say. We have a gathering coming up on December 17th at 10 because we really want to celebrate the successes of OhioISP across the year and really reflect on the milestones that you've all achieved over the year and really just recognize the hard work and the dedication and collaboration that has made it possible to get to this point. None of it, again, has been easy, and it has taken really different conversations, different processes in the work that we're doing, and we really want to be able to share that with you all. We're also going to be sharing some updates on that December 17th gathering around some functionality and IT solution updates around Salesforce. And always just don't forget, if you need any support around OhioISP, that you reach out to our OhioISP team. Several members are in the room today, and we do have a team available to support you no matter how you're interacting with the OhioISP or what you need, and they're there for you. Just some reminders about OhioISP that I like to share every chance I get an opportunity. So with the OhioISP, it is called OhioISP, but I want to just point out that the OhioISP it has 3 things in it. It has an intro page. That's a 1-page summary that really talks about the person and who they are and what's important to them and for them. You are receiving a full discovery assessment. So it is a formal, full assessment and a full conversation with a person about multiple areas of their life and what they want and what they need. And then it includes the ISP. So yes, it's called OhioISP, but there's 3 components to it. And so I just really am asking you to make sure that you're sharing that with people that you're supporting and families about what comes in that OhioISP and what they're seeing and what they're getting. Our agency, so in rule, we do require that the OhioISP, so that intro page, the discovery assessment, and the ISP is completed for all people on home and community-based waivers and all individuals who are living in intermediate care facilities. And so what this means is that the OhioISP template needs to be used for all individuals who are on a home and community-based waiver, who live in an intermediate care facility, and that actually needs to be transmitted to the Department of Developmental Disabilities, and it needs to be transmitted into our system. And that is a requirement as of January 1st of 25. So what does this look like, right? Many of you, we've been out supporting county boards, and we really appreciate you reaching out to us with questions. Many of you are doing a fabulous job or at really high percentages. So if you aren't at full compliance, what does that look like as January 1st is right around the corner? And we know that you're sending us a lot of questions of what does that mean? What does compliance mean as of January 1st? And so we're working on getting some guidance out, and we'll have that out soon for you in writing so that you'll know what we mean and what we're looking for as of January 1st. And we're working in partnership with our multiple divisions at the department to get that to you. So be on the lookout here very, very soon in the next couple weeks, if not sooner than that. Also, many of you have asked me and our team on several occasions, when can you start talking about what's next with OhioISP? And so we really wanted to make sure that we were at full implementation before we started having conversations about what the next round of OhioISP looks like and what additions or changes need to happen to the discovery assessment or the actual ISP portion of OhioISP. And so we will be reaching out with communication in early 2025. We are ready to have that conversation with you. It is not going to be a work group, but we'll have instructions and information out about how we would like to do our stakeholder and constituent engagement around OhioISP 2025. So appreciate your work. I don't expect changes in 2025, but we are going to start gathering information of what you all would like to have input on. And we will be getting input and engagement from people with disabilities and who served in our system. We'll be getting feedback from families. We'll be engaging with providers and county boards, our intermediate care facilities, and our multiple other stakeholders in the system to make sure everybody's having a chance to give us input into OhioISP. Please subscribe if you haven't to Memo Monday for more information. That's where we'll communicate both kind of what January 1st looks like, as well as any constituent engagement, what we'll be doing, where we will be, how you get information into us. Please sign up for Memo Monday if you are not, because that's where we'll have the information. And then lastly, with OhioISP, our OhioISP team has been working in partnership with the Nysonger Center at The Ohio State University to do some additional side-by-side training for county boards and people with disabilities around assessment and the very foundational elements of assessment. So we continue to hear and see that assessment is a difficult piece. And we have been asked to do some just very basic starting training. So we've been doing some virtual sessions with OSU as well as in-person sessions, really so that everybody is sitting down together at the table and really talking about what is assessment and what does it mean and what does it look like and how does the conversation happen in the assessment and how does it move into the actual service plan. So information about those trainings are in Memo Monday as well. I really encourage you guys to connect with OSU and the group that's leading that and doing those trainings. We hope it's a great starter assessment training for you as we continue to go down supporting SSAs, and we want to make sure that we're supporting SSAs and county boards in that space. Employment First is the next initiative I was asked to come and just share some information about. Employment First has been sharing, we're 12 years. We've been celebrating with all of you now 12 years of the Employment First initiative. Again, anyone who's new in the room, Employment First is an initiative that started 12 years ago, and it was really about looking at our system of support and making sure that we removed all barriers for people with developmental disabilities to get the right supports around obtaining and maintaining competitive integrated employment. And that has resulted in multiple different changes in services funding and partnerships across the state, changes at the Department of Education, and opportunities for Ohioans with disabilities in our agency over the last 12 years. And just recently, we brought back the Employment First Advisory Committee. So if anybody's really passionate about employment and wants to make sure that you are part of the conversation for the next 12 years around employment in Ohio, please engage with us. But we did have a recent meeting just on November 21st to really talk about what's next and what is still needed in Ohio around employment. Part of our Employment Force partnership is we have been in partnership with Opportunities for Ohioans with Disabilities, and many of you are making those referrals and links and connects to Opportunities for Ohioans with Disabilities. Many call it OOD for short. And so each year we partner with them through both just regular OOD services and a project called Works for Me. I just wanted to share that because of all of you and your partnership with OOD across the state, and people with disabilities, that OOD was able to serve over 10,000 people with developmental disabilities and around 1,427, so 1,400 people with developmental disabilities were successfully employed. And right now they're averaging about 20 hours a week at about $12.89 per hour. So we're really thankful for that partnership. We look forward to continuing to see partnerships around Works for Me. And then I just wanted to share about the outcome tracking system. All of you have been instrumental in really reporting employment data every year. Right now, we are in data collection for 2024. So thank you for the time that you guys are putting in and connecting services to providers and reporting. Last year in 2023, we hit our highest participation rate, and you guys completed 79% of questionnaires for people across the state of Ohio. I mean, that is an incredible percentage of entering in data. Thank you so much for taking the time to do that. And we had over 16,922 people who were employed across the state in 2023, and we expect to continue to see that number grow. That was a 17% increase in those employed from our reporting period 2019. Since 2019, we've seen a 25% increase in the number of people working in individual competitive jobs, and we've seen an actual 231% increase in people who are in self-employment. So just really appreciate it, and seeing those numbers grow and more people being supported in competitive integrated employment. In Employment First, we're doing a lot around transition age youth and support as well, and just work around our adult day support services and our employment services. So I know that we're gearing up for some additional Medicaid waiver changes around employment in July of 25. So our teams in partnership together will be reaching out, especially into the associations over the next couple weeks. We submitted a proposal in April of this year. And we've got some feedback. So we've got our next steps with that. And so we'll be reaching out to the associations over the next couple weeks, going over what that plan is for July, and then of course communicating it out to all of you as well. So thank you so much for your work on OhioISP, for your work on technology or on Employment First as well. And the last initiative I was asked, I'll hurry up, to give, are we good? It was on Technology First as well. So OhioISP, Employment First, Technology First. Again, for anybody new in the room, Technology First is similar to Employment First, but really looking at technology and really making sure how are we looking across our entire state and our system and really making sure technology is being considered for anyone at any age, no matter where they are, and how can technology help them make choices, build independence? How can technology, I can say it. How can technology help address any issues or problems or difficulties that anybody are having? And so Technology First initiative has led to multiple different services, led to the remote support service, the assistive technology service. It's led to work across the state and how we're able to pilot and innovate technology and again, what's available for people. So with Technology First, we've been keeping a close eye on what's going on with remote supports and what's been going on around assistive technology. And so we have seen growth in our remote support service. I hope that you're finding that service beneficial to the people that you're supporting. We have had a 10% growth in remote supports this year. Last year, we did have a 40% growth in that service. And so we did set a goal this year of, well, let's set it at 50. If we grew at 40 last year, let's do 50. We haven't got there, but we are still happy with 10% growth. We've had a lot of work across the state this year and really trying to support both providers, vendors, county boards, and what the service is and how it can be delivered, because we do want to make sure it's being delivered as we are required to do, that it's being delivered correctly for people. So there is a lot of resources available on our DODD website. I hope that you check it out. If you're interested in learning more, you've got some questions. We've got remote supports and assistive tech guidance available. That's been done in partnership. Again, this is a multiple division initiative between our compliance division, our Medicaid division, and policy. We additionally have been watching kind of what's going on around assistive tech services and virtual supports because we want more people to have access to that if it's interesting to them. And we have seen a 21% growth in all of those services combined. So we're seeing the biggest growth in our assistive technology service, and we're also seeing growth in our virtual support service and our remote support. So keep us posted if there's more training or more information that you need from us, because we definitely know we've got a responsibility in getting resources in your hands that help anybody understand what the service is, what it's meant to do, and what it looks like to authorize and deliver the services. Anybody especially interested in technology, we do have a stakeholder meeting happening on December 19th, so right around the corner. Registration is online. We are looking for feedback around the Technology First initiative and what we need to continue to do, start doing, stop doing. And so if you're interested in coming meeting with us in person, it will be that December 19th, so please join us. And then I just can't stop reiterating, we've got a lot of resources available that we hope really answer questions around what technology services can be and what they look like. Please visit the DODD website under our Technology First initiative, explore the regional tech hubs that are across the state, explore the supportive technology training, look at our tech guidance, call tech ambassadors. For any tech ambassadors we have in the room, I can't thank them enough for the work that they're doing across the state to talk about what technology means for them and how they see that. And don't hesitate to reach out to the community life engagement team. So thanks. Just wanted to give you a couple updates. I'm going to pass it over to Lisa.
All right. Good afternoon. So last but not least, or maybe least, I'm not sure. My name is Lisa Burt, and I am the Assistant Deputy Director of Compliance. But compliance isn't all we do. So I just want to share that with you, and I'm get myself to my slide. Okay, here we go. So I wanted to introduce Tina Haggerty and Katie Willie. They're sitting over here in the crowd. These ladies have traversed Ohio this year, going to just less than half of the states the counties in the state. And so they do a large portion of the county board review should you have questions. I know Katie will be here another day. This is Tina's last day because she's going someplace fun. But we wanted to talk about top 10 sites. Now, we just did a meeting to discuss this where we provide this information for county boards and SSAs, but we wanted to share with you what the top sites are. I'm not going to really dive into all of them. I wanted to dive into the top 5. Okay. And so with that, I'm going to share the first assessment and planning. Now, this is something that you guys do generally pretty well, especially when you're getting to learn a new person. You actually do the assessments, you're talking to the family, you're gathering, you're doing all those things. Those typically go well. Here's where the problem appears. The problem appears later when you learn new information, you put it in the plan, but you don't update the assessment. So an example, I was reading the plan yesterday and the plan said, so-and-so is so proud of their work. And they work 5 days a week, been doing it for a lot of years. And then as I read on, not only are they not working, they're attending another program, it's ADS, and they attended 5 days a week. So that's just that incongruence that, have somebody else read through it, because if you're like me, I've read it once, I'm done. Maybe someone else could take a look at it and give you some feedback on it, just to let you know where there might be some inconsistencies. We also need you to gather all the assessments and review them. If someone else has done an assessment for you, if you accept it, you now own it. Okay? So someone did a med assessment, read it, make sure it makes sense, make sure it includes what it needs to, because it's now yours. Okay? One of the things that I want to just call out without reading all this to you is if family shares something with you that they do that falls in a modality of one of the therapies or therapists. For example, cut Lisa's food into quarter-sized pieces because, to prevent choking. Ask to see the assessment that came up with that. Because chances are good, mom is doing it because it worked for her, but let's make sure that we get the assessments from the therapist, because there may be other things that go along with it, like drinking or eating, how they drink, when they drink, how they eat, those kinds of things. So you just want to put the whole package together. And so that's what you'll do with these assessments, because once you've done this, we're seeing some really good work from everyone bringing in those supports and services afterwards. Okay. So the next one is due process. We talked about this a long time ago, and we talk about it often, but what's happening is people are not completing the due process when services are approved, reduced, denied, and terminated. And if you are completing it, sometimes all of the information is not included on the document. Okay, so I wanted to just share what that might look like. And I know I'm going quickly, but I'm going to have it in this PowerPoint. You guys can peruse at your leisure, but you really do want to make sure all of those elements are included. This is probably one of the easiest things we can do, and we just need to get it done, documented, and in the file. Okay, let's just cut out this as being a citation in 2025. We can do it. Planning requirements. Okay, so we know the ISP needs to be reviewed at least annually. We know people need to sign off on the plan. We know that the provider needs to agree. And yes, we ask you to get the plan, not me. The rule dictates that you get the plan to the provider 15 days prior to implementation, unless there are extenuating circumstances. Okay, that's what the rule says. So what's happening is there may be a lot of planning pieces and you get stuck on the signature part. Or some people started with the signature but then had to make changes, and they are in a cycle of trying to get a hold of the guardian or the necessary parties to get those signatures in. So you want to make sure that you plan far enough out to get of that done. And it really is frustrating because I know how hard you work. I know that sometimes the electronic means of signing off on things don't necessarily work in your area, or it's the family just isn't involved in technology and you can't get it done and you're having to chase them down. So let them know at that meeting, hey, I'm going to need you to sign this so that it can be at the providers 15 days in advance. So where shall I send this? I'm going to send it to you. Just put it right back in the envelope and send it back, or pop into the office and sign it. Make a plan so that families can work with you to get that done, because I know that's a big deal for all of you. Human Rights Committee. Okay, so this, what I've added into this particular slide is part of the access rule, particularly when people lived in provider owned or controlled settings, that rights of the individuals must be protected. So if you're living with a shared living provider, there are no special rules for you because you live in a shared living provider's home, because that's also your home as an individual. So if I can only eat at the designated time, my rights are not being protected. So you want to make sure that individuals' rights are being protected. They have the ability to lock the doors to bedrooms and bathrooms unless you guys as a team have determined there's a reason why that's not appropriate. And no one's asking you to go back and install locks on doors. We're not asking that. The whole entire home has no locks. We're not saying that. But people have the right to privacy. They have the right to respect when they're in their own room and bedroom. And when they go to the bathroom, they should be able to have that privacy. And if they've chosen to lock the door, they should be able to do that. So that's what we have to be thinking about now when people lived in a provider owned or controlled home. And provider owned, licensed facility, shared living, provider controlled. Somehow the provider has a relationship with the owner of the home and thereby has some sort of relationship which it turns into provider controlled. So we want to make sure that people's rights are respected unless they have an approved restrictive measure. And when we talk about having visitors whenever they want, yeah, that's what that means. Having visitors whenever they want. Now, the reality is if I'm living with other people and my visitors come at 2 in the morning and they're loud and rowdy, I'm going to be asked to move. So will they. So there's consequences that come with having people over anytime you want it. Okay. And number 5, adult day programs, vocab, day services. One of the things that we consistently find is attendance being the only thing listed in the plan for day waiver services. So we need to know what the person wanted from that provider. And sometimes that's hard because people may not be thinking in that way, but when they go to day program, do they really want to go and watch a TV program and the price is right at the right time? And that's what they want to spend their day. When we walk in, sometimes we see people sleeping. We ask, hey, why'd you get dressed and come here? And they went, I don't know. Well, that person really didn't maybe want to be there, or they weren't getting their needs met while they were there. So we need to be very clear in the plan what the person's expectations are, what they want, their desires, who they want to work with. If they want to do volunteer activities, we want to make sure that those things are included in the plan and that the provider is completing those at the time frame, that at the frequency that you guys have identified. Now, there are always reasons why something can't get done. There's bad weather coming to the eastern part of the state soon. So we know that there are reasons why some things come up and why, not today, I'm not feeling it, my bones ache, or whatever people might say. But there are always reasons why not. But generally, are people getting what they want? Are they going where they want to go? Are they giving back to the community because that makes them feel good? Are they being able to have the job they want without anyone else discouraging them from that goal? Are they able to get the employment? Because, sometimes people say, oh, you don't really want that. You're doing this. This is good enough. Well, they want more than good enough, right? So we're helping them live that life. So we got to have some explanation in the ISP so that we're clear. Generally, providers want to provide it, but there are a few in the state who've kind of leaned on, I won't even, but at this point, they have not provided the service that the person wants. And we need to find out who they are and encourage them to do that. And we can help you encourage them. Apparently, we annoy people. That's so weird. We're so nice. But, we can help support what you guys are trying to accomplish with those providers and making sure that they understand that these requirements apply to all. And we've done training for all. I mean, Julie Gregg's done a phenomenal job with some training recently for the requirements of the access rule, the things that need to be included for providers to make sure that they understand that this applies to all of us. Okay, and I get it too. I've seen some really cool work done by a lot of providers. So I think we're at a stage where we need to work together to make sure that we're supporting individuals and families in the ways that they would want us to, doing the things for them that give them the same meaning to their life that we are able to decide for ourselves. Okay. Just wanted to let you know that we included the resources where some of these items are located in the PowerPoint so that you have those as well. And we'll continue, and actually these two ladies back there will continue to update and provide as much as possible because the more we put it in your hands, the better it'll be. We want success from everybody. We want everyone to be successful. The last thing I'll say very quickly is that we made some changes to our review process. We modified the sample size to match the size of county. So if you're smaller, we're not going to review all of the waivers that you authorize. So we've reduced that sample size. We've done the same with medium and large counties as well. We wanted a more meaningful experience with everyone. And so far that's been going well. We changed the scoring system, and by change, we're being as transparent as possible with the scoring. We've posted and made that available to everyone and had discussions about it. We've seen no changes in no negative impact to county boards on that change in the scoring. And lastly, I forgot it. That's all right. Wasn't that important, was it? All right. Yeah, it just popped right out of my head. I watched it leave. I was trying to grab it and it was gone. The short version is I've had some great calls with counties in the last few weeks, and we have worked together. I want to tell you, we are your partner. It is a part of our strategic plan to partner with you and everyone to make the individuals and families obtain the services that they so need and want. Thank you.
All right. We will grab it. Well, you guys keep one and we'll grab, here we go. I got Maggie and Kathy. Thank you, Maggie and Kathy. I was going to say, yeah, well, of course. Anybody have a question? I know that was a lot of information. So hopefully you wrote down any notes. Any questions you want to ask the department? I know. Oh, look at you guys. Oh, there you go. That's weird. All right.
So what is the status of CMS's review of the changes that are proposed to implement on January 1?
So we have not heard at this point, but that's not unusual. It's not unusual that we wouldn't have heard at this point. We did our 15-day call. We've answered their questions, which there was nothing alarming. So we don't expect anything, bad. So I think it's looking good, but I think we're on it's normal timing at this point.
Oh, here we go. Sorry, I'm so used to running. I can't. Yeah, I've been trying really hard to not
In the brochure or the program for today, there's an ad from a provider that says soon we'll be offering structured family caregiving and new Medicaid waiver service.
Yes, I've already addressed that with Lisa
I was
Combs.
gonna say, I got a text about that. I said, I didn't know I was supposed to proofread the
Yeah.
program.
So I've done it. No, I've done a little research and it appears as though they are talking about shared living. So it is not a new waiver service. I'm not quite sure why it's advertised that way. I haven't had a chance to chat with them about that.
Yeah, are they, so they're a vendor, right? Is it Caregiver Homes? I heard somebody told me Care Forth is Caregiver Homes. Does anybody know that?
No.
Okay.
I
So
don't know.
Caregiver Homes has
So-
been doing
Yeah.
shared living forever. We don't quite understand the words about the new stuff. Okay. That's what we need to clarify.
Allan thought it might be what Medicaid is calling their shared living like service, their new service. But again, we haven't had a chance to talk with that provider or that vendor yet.
So structured family, what's it called? Is how ODM is. Okay. So they might be expanding that way, but it is confusing in ours. We did not know.
Yeah.
So thanks for bringing that up, Jackie.
Yeah, thank
Nothing
you.
that we don't know about
Thank you.
yet. Okay. Here you go. I'll get out of it, the picture.
This one's for Stacy. And I may not have the latest information, but what is the timeline for people and families to be able to online see their ISPs, OISPs?
Okay, there. So sorry. Oh, boom. Here I am. So the biggest part with them being able to see their information in the DODD system, it depends on when it's actually been transmitted to us. So we have ways right now that providers and people with disabilities can get into the system, the DODD system. They have to get an OHID account. We can get them in, but what we are not telling everybody about it and going over the details. So we do want to make some changes to the actual landing page when they go in and what they see to make it a little bit more plain language, a little bit more friendly, but also with only bidding at 57% of waiver recipients and 56% of our ICF residents, we can't talk about it statewide because not everybody is going to be able to go in and then immediately see their information. So we are waiting to get to those percentages that to make some changes to the landing page, also to get to a higher percentage so that we aren't directing people to get in and they're not going to see anything. But what we are learning is that no matter like what vendor somebody's using, that people are getting access to the OhioISP through the vendor systems that the county boards are using. If they aren't, I don't know why it's doing that. I'm sorry. Of what they're using. So Nancy, it's a great question. And when we get to a higher percentage, we will start communicating it. I just don't want to send people somewhere and they're not going to be able to see their plan because it hasn't been transmitted yet. And so we're waiting on those percentages.
All right.
Thanks for the question.
Other questions? Joelle's got her hand up.
Thanks, Maggie. Quick question. Phase 1 of the waitlist assessment went out obviously November 1st, and due process was mentioned in the rule about using official JFS due process, but we've been waiting on some clarification if the combined county board form for the 3 types of due process would be able to be used with that. Do we have an answer on that yet?
No, it has been sent to Bureau of State Hearings, so it will go through the process, which is time consuming. So there's nothing new with that, other than it's in the process. It's been submitted. That's not. Will they be cited?
No, if you're using a due process form, no, you won't be. Just make sure you complete it all. The citations have been around not using it at all, not completing it, or not doing it at the proper intervals typically. So no.
Up in the back. Maggie, you're getting your exercise now.
Yes.
Kathy's side. Your side is slacking. Make Kathy run.
You talked about a support intensity scale. Is this a scale that has already been developed that you're using, or is this a scale that you have an RFP for development?
So it's an assessment that was developed years ago. I don't actually know how many years ago. and is in use in maybe 13 other states right now. We don't have a contract to use it yet. We're still working through how we would implement it in Ohio if we are to do so. But it is already in use in a variety of other states. Yes, AAIDD.
And OACB does have a kind of a work group that's looking at stuff. So if you have input questions, you want to do it, you can reach out to us also. We'll tell you about what we found out and where we're at, so. Any other questions? All right. You guys, it's a nice being here right at the end, right? They're like, nope, it's time to go. Thank you. Let's give a hand to the department. Thank you.